Good evening, everyone. I'm Dr. Kanisha Zimmerman from Duke University. On behalf of the ABC Science Collaborative, I am pleased to welcome you to the COVID-19 in the Classroom webinar series. Tonight, we'll be talking about athletics, band, and other extracurricular activities, how we're going to stay safe on campus. Next slide, please. Next slide, please. So as usual, our format will be that we'll have a little presentation about some of the existing data, and then we will take questions that come in from the comment section in the YouTube. We will answer those questions live tonight, and the things that we don't get to, they will be added to our frequently asked questions, or will be provided additional information within additional webinars. Our abcsciencecollaborative.org website is available, and the webinar slides and the videos are available there. We will have Dr. David Weber and Dr. Ibikun Akinboyo, who will be our panelists tonight, and Dr. Akinboyo will start us off with a bit of evidence. Dr. Akinboyo?
Thank you, Dr. Zimmerman. Thanks for everyone joining again this evening. Since we have a number of different aspects that come into sports, we wanted to just set up the context and ensure that everyone's aware of the guidance from NCDHHS, so North Carolina Department of Health and Human Services, addressing what sports could or might look like. One of the key, just adjusting my view here. So one of the key parts of their recommendation is that there should be a plan. So everyone that's considering what sports programs for kids might look like needs to have a documented plan that minimizes the transmission of COVID-19. And they're strongly recommending playing sports in which participants can maintain social distancing. And I'll walk through some of the, okay. 1 second, working on my audio. Can you hear me?
Yes, we hear you.
Okay. All right, so I will continue. It seems like at least one person gave me a vote, I'll continue. The next few slides, we're working through the specifics that, sorry, before we go to the next slide. So we're working through some of the specifics that NCDHHS has suggested. But remember, these are guidance, these are guidelines. I think it's important, and I know each local school district is working hard to ensure that whatever comes up fits into this guidance, but also makes sense for your local community. So this first slide is just discussing or showing sports for which participants can maintain social distancing. So NCDHHS recommends limiting sports activities or your plans for sports activities to these sports, which are categorized as green, where we expect social distancing can be maintained or close contact is limited. You see that most of them are individual sports. Some are indoors, some could be outdoors, and a couple of them are water sports. Next slide, please. So the yellow category, and this is not all inclusive, and I'll of course defer to our colleagues within the health department for specific questions around this guidance or your school leadership. But for the yellow category, these are sports where close contact may occur, but should be limited and not prolonged. And as much as possible, the guidance states that if face coverings can be used safely, they should be, particularly when children are not actively playing, and certainly by all of the referees or all of the people that have to be coaches that have to be present while that event or training or sport event is happening. And limiting tournaments that involve multiple teams coming together. Now, these tend to be more team sports as compared to the green categories that tended to be more individual. Some water sports are here, and you notice tennis doubles is included here. Again, not all inclusive. Next slide, please. And we're just reviewing the guidance here. The guidance also states limiting some activities where participants cannot maintain social distancing as part of just the normal act of playing the sport. Again, most of these are team sports. Some of them occur indoors, some of them occur outdoors. I will say some districts, not necessarily always in our states, but some schools have crafted some plans for either the fall or the spring that may involve bringing some of these things back, but the current guidance is to limit these activities. for now, and I'm sure they will continue to review the literature and see if and when we can make a different plan around some of the larger events and larger sports that have bigger teams, and it would be nearly impossible to play the sport without contact. Next slide, please. So why do these things matter? What may have informed the guidance? Again, we're not coming up with new guidance here. We're kind of walking through what data informs the guidance that may have come out from the CDC or the state, or what some schools have offered to do. So I'll go through a few studies. Some of them are early on in the pandemic, and all of them have to do with adults. So yes, there may be questions about, does this directly apply to kids? And I think we can learn from them. Transmission in kids may be different. We've spent a whole session talking about what transmission might look like, but there are lessons to be learned here. So this first one is from Slovenia, as early as March 2020. Remember, in those times, we're still learning about how this virus spreads. A lot of times people were not using masks in a lot of indoor settings, and this transmission event occurred in relation to squash, so squash indoor court. There's a cluster of about 5 cases. The figure on my right, looking at the screen, just kind of shows the chronology of infections. And the key point here is the people that were impacted, or the people that eventually became positive, there were 5 cases, all played in the same day. They didn't all play together. They sort of had staggered times, but they all used the same court, may have used the same dressing rooms. And there's this question that they may have touched similar items. There were at least 2 of them that actually interacted face-to-face with each other. And this was a small room with poor ventilation, lots of moist air. The players were in there for a long time, greater than 45 minutes, and of course, breathing hard, playing squash and running around. And no masks were used during the sporting activity. Interestingly, and the reason why this suggests indirect transmission, so something related to that environment, is that all of the employees that were present were not infected. Just something to how this virus spreads, particularly early on before we knew a lot more about the virus. Next slide, please. This is another cluster, again, an international, it's an international setting. This was in South Korea. Again, early in the pandemic, we were still learning. Lots of countries were just trying to figure out what their masking mandate would be, how this would impact sports, singing, lots of things like that. And here they report 112 people infected with SARS-CoV-2, the virus that causes COVID-19. In this case, there was a cluster of instructors. So the first cases occurred with instructors that were training for about 4 hours in an indoor setting without masks, and about 30%, a third of them became positive right after that. And of course, in retrospect, they look back to just trace the activities. Those teachers sort of spread out, taught other classes, and about half of the cases they found in the students, these are all adults, were related to interaction with the teachers. It's unclear, or the instructors, in this case, remember, we're talking about sports today. It's unclear if there were actual direct close contact or they were all in the same room, but it's very clear that the intensity of the workouts, having larger class sizes, which was a key part in the South Korean cluster, within small spaces. So small space, lots of people, and working out, breathing heavily, sweating for a long time could increase the risk of spread. Next slide, please. And then bringing it back home. So this is a more recent description of an outbreak of COVID-19 infection that occurred in relation to an indoor recreational hockey league, hockey game. This was in Florida. A couple of things to note. At the time, so in June 2020, Florida was seeing quite a bit of spread in their local communities. None of the people involved in this cluster wore masks, even in the locker rooms, even during the pre-game interactions. Some could argue that some of the intense sporting activities may be hard to do with a mask on. So quite a few leagues that have opted to start don't have the players wear masks during the actual game. But quite often there should be masking in every other activity leading up to the game. And that was not done in this case. But you'll see in the figure on my left, looking at the screen, the y-axis shows the number of cases. Starting with the game on the 16th of June, x-axis showing the date. looking back, they figured out that there was at least one patient that was a player and developed symptoms a day later. They all reported being asymptomatic, and that's why they showed up for the game. But this person may have either had mild symptoms or definitely had the symptoms a day later. And over the next 3 to 5 days, similar to the incubation period of SARS-CoV-2, the virus that causes COVID-19, you can see this march down to include the two teams that play together, Team A and Team B sport members, and even a ranked staff member getting infected over time. And then that sort of ended the cluster. And the point from this was that close contact sports and intense physical activities can contribute to the spread of COVID-19, particularly in indoor sporting, high intensity physical activities. And so the CDC summary was 14 out of 22 players developed COVID-19 after an indoor ice hockey game. Next slide, please. So what does that mean, practically speaking? So we're going through this data. Some of them were early in the pandemic, but then we're also in an era where if you turn on the TV tomorrow, I guess over the weekend, or even the prior weeks, we've seen national leagues, for example, the Basketball Association, so NBA team, have a full season, relatively full season, COVID-19 2020 style, where they bring players together and they're able to have high intensity workout activities. You can argue the NFL has been doing it a different way, and that may be working out somewhat differently from what occurred in the NBA bubble. For those that may not be aware, there are many papers and many articles reviewing what the NBA chose to do. This was a very expensive and intentional activity to bring players into Disney World, and all of them got tested, quarantined for about 48 hours, and then had periodic testing during the course. It was a locked down environment, and the key part here is there were very limited coming in and going out of the bubble. Realistically, that can not occur for most people. We know that our teams involve kids that go in and out of school, in and out of households, even in a college setting where people are relatively on a campus. It's not a closed setting. Most colleges are either within a town, within a city, and there's interaction with the local community. A bubble effect can only work if it's a true bubble and it's completely closed off from the external world, or there's a trickle into the bubble where you're testing and quarantining everyone that comes in. So while this has been a successful example of how to have a high intensity sporting activity, I think outside of testing and creating a bubble, there are other things we can learn from the experience. There was an intentionality here. They had clear protocols that everybody bought into. Some of them took a little while, but eventually everybody bought into. They tracked players, and all players agreed to limit the activities. So wear a mask when you can, and limit your activities to ensure you're not exposing yourself. And I think we can all learn from that and practice that versus just recreating a bubble in a different setting. Next slide, please. As we're switching gears, I'm going to hand over to Dr. Weber to kind of go through some of our slides on similar thinking about athletics and sports and bringing in hard work that occurs with chorus and band and some of the wind instruments.
Thank you very much. So we already have in previous meetings discussed that this disease, SARS-CoV-2, is transmitted by respiratory droplets. Anything that leads to greater expulsion of droplets leads to enhanced transmission. So as we heard, sports with deep exercise, taking deep breaths, potentially sneezing, coughing with that is going to lead to dispersal of droplets. This is true for singing. People have shown that you have more droplets and they go further distances with singing. And one of the well-described outbreaks in the United States was at a choir meeting. And it's true with wind instruments as well. Things like trombone, trumpet, again, forcefully exhaling into those instruments propels the droplets further. And of course, if someone is infected, and we know roughly 40 to 45% of infected people are asymptomatic, or they could be mildly symptomatic, those droplets will be expelled in larger amounts and potentially travel further distances away. Of course, the other issue in general when singing or playing a wind instrument, people for the sound effects tend to be within 6 feet of each other. And of course, they are usually not wearing masks. And again, all of that further increases the risk of transmission. Next slide. So there was this study. It did show under experimental conditions a variety of instruments generate aerosols in varying amounts. They do show, not surprisingly, that if you cover a wind instrument with cloth, much like covering your face with a bandana, they could produce less particles. But this didn't actually look at infectious virus. And we shouldn't interpret this to say just placing a simple cloth over a wind instrument renders transmission impossible. First of all, you'll notice that even placing the cloth over the instrument doesn't cover your nose, and we know the nose is clearly that is the most sensitive place for finding virus, so that won't prevent transmission. So, well, yes, anything that impairs or decreases spewing out particles will likely decrease transmission, but that doesn't mean that putting simple cloth over a wind instrument is in fact safe. Next slide. And I think I'll turn this back to Arbukin for talking more about participating in sports at this point.
Awesome, thank you, David. So of course, we will try and ensure we have adequate time to address some of the questions around both sports, athletics, and sporting events that occur outdoors, including band chorus that may also occur indoors. But if we get to a point, so if your child is participating in sports in our current environment during the COVID-19 pandemic, the AAP and a couple of other national groups have come up with some guidance, both for medical providers and for parents and kids to understand, and of course, coaches, all of the teachers and educators that may be helping with creating protocols around this. They've come up with guidance to help understand what safety might look like, how to optimize a child's participation, but not suddenly increase their risk exponentially by participating in sports. We have a link here, which will also be available afterwards, that has a safety checklist that you can go through personally. I also think is built into a lot of the protocols that the school districts or sporting leagues are considering if they're choosing to go ahead with a type of sports, with a type of sport. Next slide, please. And then also it's important to just remember we're discussing a disease that we're still learning about. The pediatric cardiologist came up with a return to play guidance after children have developed COVID-19 infection. A couple of things to remember. We've established and we've said that children can get infected. They can spread the infection. It does tend to be, the infection tends to be a bit milder in kids or asymptomatic. But when we do see kids infected, a small proportion of them end up in the hospital. Or we see this late inflammatory syndrome, multi-system inflammatory syndrome in children, which can be pretty severe. Thankfully, a lot of kids do fine and return home quite quickly. But that being said, we don't want to underplay some of the risk that may be associated with a quick return to sports if a child has had COVID-19 before. So some of the guidance, which is important to know about, and of course, it's important to work with your pediatrician, your provider, if your child has had COVID-19 and you're considering a return to sport, there should be a sports participation clearance built into getting back into sports. And pediatric patients should have fully recovered, which should include recovering of symptoms, certainly no fevers or any active symptoms going on before they return to sports. And the recommendation here is they should be at least asymptomatic for about 2 weeks after their course of illness. For youth, so we see some of the cardiac heart concerns in our older kids that may be in that middle school to high school age. I think this is already part of the safety protocol, but just ensuring that youth and high school sports have reevaluated their emergency action plans to ensure that everyone's trained in CPR and they can address anything that occurs related to a cardiac event. And this is standard practice. It's just a reminder that post-COVID infection, we should pay attention to what's occurring. Next slide, please. So we'll pause here. We have a lot of time to walk through different questions. There are many ways to sort of approach sports, athletics, music, band. I think hopefully with our group here, we can kind of talk through ways to think about this in coordination with the guidance that already exists. So I'll hand over to Dr. Zimmerman.
Thank you, Dr. Akinboyo. I'm going to toss back to you just for 1 second. Can you just maybe clarify some of the information regarding sports and the kind of different risk zones and why they would be risky? Would you mind doing that?
Yes, and so some of it is we were showing the parts of the guidance that exist, and I think we've all gotten used to seeing things around COVID-19 in the green, yellow, and red categories. So my understanding about the way the guidance is worded is that we're trying to show some examples of sports that may have increased risk of COVID-19 spread if you have at least one person with COVID-19 participating in that activity. It could be because the method of play involves close contact, which means most often, if you're running around playing soccer, most soccer leagues, they're not having them keep a mask on, and to tackle or get the ball, you have to come close to your opponent. And so I think that's why it's somewhat medium risk. A lot of soccer leagues could be outdoors, so that puts them in that yellow category. As compared to, say, in football, where you huddle, you lean in while breathing hard. I think this is my perspective, thinking through the color categories. That may be why that's put in a red category, where you really need to restrict restarting that, or work pretty closely with your district to figure out what the safest way to restart activities that may be in the red zone. The easiest lift may be activities that have now been labeled as green, so it's a green category. It's a publicly available guidance document. Each district may have something slightly different, but it's just a starting point, and we can kind of build off of that.
Thank you. Dr. Weber, I'm wondering if you might talk a little bit about the science behind instruments in particular, and I guess distance of aerosols or generation of aerosols related to that, perhaps as compared to a physical activity, another physical activity like sports?
Certainly. So whenever we breathe out water droplets because our lungs and mouth have saliva in them. And so there are droplets coming out. They're largely water, and they include cells and dead cells and other materials, as well as things that we breathe, dirt and particles that are being expelled. Normally, those particles with normal breathing will go anywhere from 4 to 8 feet along the way. They are drying, they're settling, they're being dispersed in the air, and they're largely initially water droplets, essentially little rain droplets that below the level that you would actually see them. Of course, there are many ways to expel more droplets. When we cough or sneeze, they go further distances just because of force. And as we yell, shout, sing, or take deep breaths with exercise, that's going to propel those droplets, more droplets, and they go somewhat further. Now, they don't go 20, 30, 40 feet, but they may go beyond 4 to 6 feet at times. Now, of course, with an instrument, you get two effects, like, say, a trumpet. One is you're breathing hard, so you're being more forceful, which will push the droplets further. Plus, obviously, by putting them through a smaller opening, you're focusing them more than if you just breathe, where they just get dispersed. Of course, if someone is non-infected, non-infectious, then it really doesn't matter what they're spewing out. It's only if they happen to have COVID, and we did mention 40% of people who are infected don't know that they have COVID, they're asymptomatic. And then another group of people will develop COVID in the next few days, but during that pre-symptomatic period, they in fact are infectious, again, even though they don't know it. So any activity which makes you breathe deeper or more forcibly or cough, sneeze will propel droplets a further distance and propel more droplets out, thereby making you more infectious.
Thanks, Dr. Weber. And then one more question to you about kind of wind instruments. There have been, you mentioned kind of the coverings that may go over the end of the wind instrument. There's also a recent study talking about, or a recent, I guess, documentation of people covering the instrument themselves and then having masks with a hole in the mask in order to be able to use a wind instrument or trombone or something like that. Can you speak to those as potential benefits?
So the answer is yes. That has not been very well studied yet. And of course, how well a mask works depends on both what the material is, how well it filters out particles, and how tight it fits. And obviously, the way we've proved that masks work on preventing an infected person from transmitting disease is by putting actual masks on people who have not SARS-CoV-2. We wouldn't do that and measure it, but on influenza, the regular endemic coronaviruses, and actually proving that they do not dispel infectious particles into the air. Theoretically, we could do the same studies with asking somebody to just, do jumping jacks and who's not too sick with a respiratory virus, or ask them to play a wind instrument and see how well it works, covering it, putting a mask on with just the hole. Other ways, I'm not aware anyone's done that yet, which would be the final proof. Of course, if the non-infected person wears a mask, that is providing substantial protection. I just saw, again, what we don't really know well is, the relative amounts that are propelled by each wind instrument and by each type of exercise. So if you ask me, which propels more particles into the air, running 20 feet and tackling somebody in football, running across the field in soccer, running, 5 miles in a race, those sort of very fine details have not been really well established. And then, is it different between male and female athletes? Does it depend on how in condition you are? So a well-conditioned athlete who may not be huffing and puffing as much, is slow, prolonged activity better than short, fast activity like running a sprint? I'm sure all of those are of interest to all of us, but really those have not been well scientifically studied yet.
Thank you, Dr. Robert. Another question related to this. So one of the studies on wind instruments and singing, et cetera, talked about HEPA filters, and there was a recommendation within the article about HEPA filters and about distancing. Can you just talk a little bit about the evidence behind that?
So certainly HEPA filters are widely used in medicine, but we have one in our bedroom because my wife has lots of allergies, just to keep the dust and the dander out. By definition, a HEPA filter removes 99.9% or more of particles in the size that would infect us or lead to allergies, and they're very efficient at doing that. That said and done, there was one study that did look and actually showed in a hospital patient's room with COVID that he could expel infectious particles up to 12 feet away, and they had a UV light in the ceiling that filtered the air and killed particles, but didn't prevent this transmission. And the reason is, if you're in a room now looking on your computer and there is a HEPA filter in the corner of that room, and you're 3 or 4 or 5 feet away from the computer screen, and you give a good sneeze without a mask, that HEPA filter in the corner isn't going to do much to prevent those particles coming directly out of your nose and mouth and going 3, 4, 5 feet away. And the same thing would be true for a wind instrument. So if you had a band and there's a conductor standing 5 or 10 feet away directly in front of the band and the instrument's facing them, putting a HEPA filter in the corner may not interrupt that very direct flow. A HEPA filter is certainly not going to do any harm. It's likely to provide benefit, but there is no data to suggest that if you put a HEPA filter in the room where there's a lot of singers, a choral group, or a band playing, and the people are unmasked, and particularly within indoors, poor ventilation otherwise, within 6 feet of each other, that HEPA filter will actually protect them. So it's certainly something we have to study. There's no harm in using it, but one at this point cannot scientifically say that would eliminate the risk of COVID transmission.
Thank you. Dr. Akinboye, there's a question in the chat about buses and whether or not having windows down might actually be helpful in that setting, or what could be helpful in the setting of a bus.
That's a good question. I think similar to our conversations around buses to get to school, we may incorporate some of the guidance around those too. I'm going to assume needing to use a bus to get a team, for example, to another event. So as much as possible, having mask used while on the bus and spacing out as much as you can. I think it's a bit more difficult when you're traveling longer distances to all of a sudden have more buses to try and get there. But hand washing, spacing out when you can, and having a mask on every person that's in the bus as you travel is probably a good idea. Yeah, you could, anything out, we've said outdoors, being outdoors, opening windows reduces the risk of spread in a closed setting. But I think for longer distances and as we're going to colder months, this may defeat the purpose. And of course, just looking at our public buses, they do not have their windows open, and we have not seen clusters associated with using the bus or amongst people that have reported using the bus. So there are ways to travel safely. I would encourage having a mask on everyone, and of course, screening for symptoms so no one's traveling long distances while symptomatic.
I would add, there's at least one outbreak on a bus that was well described. And interestingly enough, although some people beyond 6 feet may have become infected, those sitting by an open window did not, with one exception. So if the bus has windows that can open and it's not too hot or too cold, that would at least provide some protection to the person potentially right next to the window.
Thank you for that.
Dr. Weber, are there any instances that you know of that have been, or circumstances where there's been success in being able to either sing or play instruments, or outside of the NBA bubble play sports? Can you talk a little bit about the available evidence?
Well, first of all, we should say non-wind instruments are fine. People drumming and things like that are fine. Again, as long as they're masked and ideal, practicing physical distancing. Again, we don't have good details on all the different sports, and so people are classifying sports into high possible and no risk simply based on just observations and the likelihood of expelling particles. But we really don't know the risks for each sport. The more time you spend close to people without masks, the more you're particularly like in very poor ventilation, like inside exercise rooms or potentially pile-ups in football, the higher the risk. But again, there's nothing magical just about sports. Any indoor activities for which people are not wearing masks and they're within 6 feet of each other represents a risk for transmission. Sports, just because, as well as singing, choral activities, and other things, represent presumably a higher risk based on the amount of expulsion of particles that could be infectious. But again, any indoor activity, particularly within 6 feet and with unmasked people, represents a risk.
Thank you, Dr. Weber. So just to clarify, there's a question again about types of masks and whether cloth masks are reasonable. Can you just clarify that information?
Sure, absolutely. So a medical mask, first of all, meets certain standards by the Food and Drug Administration, and we know if it's an FDA-approved mask, how well it works. Cloth masks in our hands, and we've studied a number of them, some work as well as a medical mask. It depends on what the mask is made of and how tight the fit is around the nose and the mouth. The masks clearly have to go over the nose and mouth to be effective. And if you have anything that impairs the tightness of fit, like a beard, a mustache, or some deformities of the face, they won't work as well. The problem is, of course, there is no standard for homemade or cloth masks unless they've been approved as a medical mask. So you really don't know exactly how well it'll work. Again, the best you can do is the tighter the fit, the better it is. Multiple layers in the mask suggest it would work better than a very thin layer. But and as I said, the non-medical masks that have good fit, tightness of fit and the proper materials work as well as a medical mask. And in our hands, by the way, the right gaiters work just as well as a medical mask as well.
Thank you very much. Dr. Akinboye, can you talk some about indoors versus outdoor activities?
In terms of spread of COVID-19, yes. So we're referring to a lot of our athletes and sports, band, chorus, things like that. And I think the overlying point is right now it's really hard to say every group has to do one thing. I think the main point has been, we know some activities pose a higher risk in some settings. If things are done in an outdoor setting, particularly if it has to do with a larger number of people involved in the activity, so a large band as compared to a small choir, for example, if it's done outdoors and spaced out, it reduces the risk of spread. That being said, we're here to review the evidence and kind of talk through ways to make it practical. When we move activities indoors, as we've shown, we've seen higher rates of spread in all of those activities. So putting all of it together, we're thinking of athletes, sports, singing, being in a band, and using a wind instrument. Can each of those things be done safely? Yes. Does it always have to involve a mask or face covering? I think for the most part, yes, although we have seen some very specific events, or maybe sporting activity, or even some practice events that occur in a large field that may occur unmasked and we don't see transmission. So we can talk through ways in which things can be done safely. Lower risk setting would be in an outdoor setting, spaced apart, masked if possible. If not possible, definitely even almost doubling the space between players when you can, or between participants or students. So I hope I addressed that question. The main point being, if we can do things outdoors, we should. It's safer. If we're indoors, ensure that participants are masked when you can, or if the actual players are not masked, everybody else associated with the event remains masked. And limiting spectators is also an option.
Thank you very much, Dr. Akinboye. Do you have other advice for kids returning to school and thinking about other extracurricular activities, maybe clubs?
So I've been impressed by sort of the resourcefulness for people around restarting activities, even with all of the restrictions that have been put in place. For now, most of our guidance or most of our conversations have involved a staggered approach to things. Are things going to be safe when you come together? I don't have a specific example of an extracurricular activity, but there's some that can be done safely. There's some that can be done virtually, but it may limit the experience. As clubs restart, and I think they should. I think so many of our kids have struggled with not having ways to interact or to build their skill set. So over time, I think we can get to a point where we start to restart our activities, but it does have to be a staggered approach, sort of starting everything at the same time and make it hard to even know if it's a successful strategy or not. So for example, starting with getting kids to class, if that's the plan that people have, and then slowly building in extracurricular activities or something else over time. It's just one suggestion. We have a lot of guidance, and I respect all of the schools' protocols around this, but having a slower pace will probably be advised.
Thank you very much, Dr. Akinboye. Dr. Weber, can you talk some about sports in the collegiate setting and what's been happening there and what we're seeing in that setting?
Certainly. In the collegiate setting, as you all know, there have been outbreaks among sports teams. Those have actually been less related to transmission on the field or in weight rooms, but the student athletes going off campus and not wearing masks and not physically distancing has been the major issue. But beyond that, there has been evidence both in collegiate and as well as professional football of transmission on the field, potentially again. Again, it's hard to look at all the contact sports, but certainly in football, there has been some evidence of transmission on the field. Now, of course, the sports teams are different than what we could do in a K through 12 school. In the professional sports, they get tested every single day, and they live in a bubble. That's not worked 100% of the time, but it certainly worked in general reasonably well by just having them all stay and have some hub, and they just live in their hotel all the time, and they're in an entire bubble, and they're getting tested every single day. In fact, that's one of the reasons that over the last several months, testing has been in short supply. Much of it is being sucked up by all those teams. In college, we're not testing every day, but we're testing 3 times a week. And I should say testing is not a prevention strategy. It's an early detection and containment strategy. You can test every single day, but if people then go out of their bubble and don't practice physical distancing and mask wearing, they're going to transmit disease, and the testing every day will just catch it faster and slow it down. But the bottom line is they can do things that can't be done in K through 12, and they have shown that obviously transmission in indoor areas like weight rooms, or if people are not safe off the field or on the field, can be a risk.
Thanks, David. One question coming back at you. So you've talked some about music activities and some of the available evidence. What music activities can be done safely outdoors, and under what conditions should they be done?
No, excellent question there. So I think particularly if you're doing any activity that requires people not to wear masks, whatever that is, it's clearly much safer to be out of doors. I don't want to say that the physical distancing is crucial, because it's just in general not practical, obviously, in most classrooms to put, unless you're obviously only doing only a small number in the classroom, to put everyone 6 feet away. But if people have to be together on some training activity, whatever that is, that many people are going to be within 6 feet doing something, it's clearly safer to be outdoors than indoors. Of course, being outdoors is not possible in rainy weather, may not be possible as we get into winter, and it may not be possible in the hot months either. But outdoors, everything being equal, is preferable to indoors. Just from a COVID standpoint, there are other issues like noise and pollution that may be more distracting outside there. But I think that certainly if you can do it outdoors, it's an advantage.
Thank you very much, David. One question coming right back at you. Sorry, I asked you a question about collegiate sports. Do we have any evidence or information on collegiate, like arts, band, etc.?
About bands? So again, if the bands are performing, they're being tested as well, as are cheerleaders as well too. That's in part to protect them, as well as to protect transmission to the players. The cheerleaders and the bands, one, are spaced out at more than 6 feet, and they are, of course, outdoors there. And for both groups, they have been limiting the number of people in those to reduce the numbers as much as possible. In fact, they are trying to essentially go to virtual bands and virtual cheerleading to the extent possible. I have not seen good studies looking at those practices to see what, if any, transmission there's been among cheerleaders who are shouting. And I can't tell you off the top of my head how often they're wearing masks, which they could, in fact, do, and use mics and things like that to project their voice. And nor can I tell you for the bands how many times the bands are within 6 to 10 feet of each other, and whether they're using some type of protection over a wind instrument or not. I've not seen that carefully studied, although, knowing that there are 60,000 plus papers on COVID, it's certainly possible someone has studied it, but I'm not aware of that.
Thank you. Dr. Akinboye, you talked about a phased approach. Can you maybe talk about what a phased approach might look like for the arts, in particular with wind instruments?
With wind instruments, I think it probably would involve a lot of work. I know a lot of people have seen articles regarding some schools or universities that have studied masks for instruments and using those masks for instruments outdoors, using masks that have holes in them. So potentially starting off with non-wind instruments if possible. Again, this is just a suggestion. I still defer to all of the guidance that might be in place from our state. So starting off with non-wind instruments and seeing what that goes, how that impacts transmission amongst people participating, particularly if it's outdoors and spaced out. And then slowly building in some protective environment around using wind instruments when and if it's safe. I can't pick a particular time for when it's safe, but to start that, it probably should be outdoors as much as possible. And then if that doesn't lead to any clusters, you can slowly build into having it safely indoors. And I'm hoping this will be in the context of us seeing lower community transmission, because that ultimately means we would reduce our risk of spread. As far as I know currently, most of the stated guidance around this, so not just sort of a study from a university that shows how this can be done with protective equipment, which is good and which is true. We can do some things with some additional PPE, and that's helpful. But I think we have some organizations in our state that have worked hard to try and push out some guidance around this. It may not be as descriptive as it should be, but most of it involves deferring wind instruments until we can at least start up with some in-person education activities, extracurricular activities, see them occur successfully, and then build in some things that generate aerosols. My suggestion would be aim for outdoors, aim for a slow pace, and work it into the curriculum over time.
So Dr. Akinboye and Dr. Weber, I've heard both of you say, that essentially that we're still early with regard to the arts, that there's just not a lot of information that's available. Am I interpreting that correctly? And could you, and then Dr. Akinboye, maybe could you speak to the Colorado study specifically? I know we mentioned some of it, but.
Yeah, I can. And of course, we didn't delve into all the nuances of it. I think we're still learning a lot about transmission in some settings. We know what works and we know what can reduce the risk. The key part here is, other than I think some summer camps over the summer, particularly so in North Carolina, just focus on North Carolina for a little bit, where there were musical instruments or musical camps that occurred. And as far as I know, again, I think occurred fairly safely using a lot of precautions. I have not seen large studies where bands and choirs have come back together and have had limited COVID-19 transmission. I know we've seen chorals return, particularly in some religious settings, and they've been able to do it safely. Those numbers, when I look at them, are much smaller than the average school district. So we need to learn a little bit more, but we actually have some things already about ways in which we can't lose the arts. We need this kid, we need it for our kids' development, and it's extremely important. And we see that COVID-19 is going to be with us for a number of weeks to months and into at very least late next year. So I think we do need to creatively come up with ways where we can return to some semblance of normal and bring in kids and bring in art and bring in music. I just think it needs to be done slower, in a slower pace than a couple of other activities, and with a lot of clarity around what the precautions might be.
Thank you. Dr. Weber, can you speak to theater? Can you maybe talk about how we could make that a safe environment?
I didn't catch what you want me to speak to again.
Theater?
Oh, theater. So again, the key, obviously, and there are obviously many arts, painting, sculpture, all of those. Again, I think all of those can be done safely if people are masked and, to the extent possible, doing physical distancing. Obviously, anybody who's ill should stay home, whether they're a teacher, a staff member, or a student. So many arts can be done safely. I think theater falls into that group as well. Ideally, outdoors are safer than indoors. And obviously, you certainly lose a lot of the expression by people being masked, but that would be the safest way to perform theater. And again, using canned music or non-wind instruments to accompany the theater if one wanted, I think obviously would be safer. In terms of dance, it's the same thing. I mean, to me, dance is a form of exercise, and it really depends how strenuous the dance is. Certainly some dancing is at or more strenuous than any contact sport. Other dancing may not be. It really depends on the level of exercise. Again, it's clearly going to be safer if people are spaced out, and it's going to be safer if people are masked. And we've already talked about how you want to sort of bring things back slowly and see how it goes. So before you started a huge, tap dancing group of 60 people all on the stage at the same time, you might want to start small and see how that works there. The key, obviously, the best protection is having everyone masked, whether it's theater or dance, and starting out maybe with not a 2-hour performance where people are all huffing and puffing at the end, but doing smaller performances, giving people chance to rest, or individual instruction with an instructor and a student, distance for more than 6 feet. Again, being masked would be the safest way. Now, we can't give you absolutes and say, if you do this much time, this forceful exercise, take your heart rate. If it goes over 100, you're doing too much exercise. That data just doesn't exist. Masks are effective. Physical distancing are effective. They're additive. But masks are really the critical issue there. Things outside are safer than indoors. The smaller the group, the safer it is, and the more you can practice physical distancing, the safer it is. But we can't give you absolutes about do this and don't do that.
Thanks, Dr. Weber. It sounds like there's a lot of data, or a lot of holes that we need to be able to answer. Dr. Akinboye, I know I asked you about the Colorado study, but I'm not sure that I caught your answer. Can you just readdress that?
I may have talked myself. I probably didn't address it directly, so sorry about that. I think what people are referring to is it's a preliminary study that addressed the use of those masks that may have a slit for musicians to play an instrument, and also have some type of covering over the instrument, and tested in using, we don't have to go through the techniques, but try to assess how much reduction you can have in aerosols that are generated into an environment. And they saw some success. So clearly by covering an outlet, covering the mouth as much as you can, so maintaining the mask over the nose, certainly can reduce the droplets that are generated. But as we've said, I think in prior conversations around this, having a mask on that has a slit may somewhat defeat the purpose of a mask. And we agree in principle with the findings of the study in relation to having social distanced rehearsing, or having practicing in a well-ventilated space or outdoors. I think those are the things we've said as well. So we agree in principle. I'm just sort of somewhat repeating the guidance around using instruments, particularly in our state, they've not studied, or they've not pushed for the mask with a slit. But it's a study, and I think we need more studies, and it certainly supported some strategies that could reduce droplet generation and, of course, reduce the risk for COVID-19.
Thank you, Dr. Akinboye. Let's see.
And I could certainly add to that. So as we learn more and more about how masks can be used safely, I think none of us are a big fan of using a mask that has a hole, but some people have double masks to make it a little bit safe. And people have very creatively covered every part of an instrument that could lead to droplet production, but still be able to produce sound. I do think there are ways things can be done safely. Again, we're functioning under guidance. We review it and we talk through what are practical ways to have a feasible plan. We're not coming here with an agenda or a set plan, but having those options may make it easier to restart.
So it sounds to me, again, Dr. Akinboye, that we just need more data, that we have some information, we have some promising things. Things are moving in the right direction as far as that's concerned, and people are being very creative. But as far as studying in a very controlled manner, how these things are working, how they reduce transmission, we just don't have that information. Is that correct?
I think we have some information. So we're in a different place than, say, before the summer camps happened, before some other counties outside of our state have restarted in some ways, and we haven't seen massive clusters associated with some things. But we all remember, and we've all confirmed that some of the earlier clusters and some of the ones that have occurred recently have occurred around, say, for example, a religious event that had a lot of singing, or earlier on the Seattle case, which I think most people are familiar with, where a choir got together and it led to infection. But those were without the use of a mask. So we do know more than we did before, and we still have a lot more to learn.
Great. Well, thanks to both you and Dr. Weber tonight for talking about the arts and sports, and a lot more to learn, but I'm really hopeful that we're moving in the right direction. It's been a pleasure to have you guys here with us this week, and we look forward to seeing you the next time. Thank you very much. Take care.